London is an amazing city and we've made great strides in tackling the HIV epidemic, but there's still more work that we need to do. We need to tackle stigma for HIV. We need to ensure that more people are getting tested and being diagnosed much earlier with their HIV. And we need to ensure that everybody is able to benefit from the very high quality and effective treatments which are now available.
I'm here today as part of the Fast Track Cities initiative in London. It's an ambitious programme which is aiming to get to zero. It's a really exciting and challenging piece of work that we can't do unless we're doing it in collaboration with a number of key partners and stakeholders.
One of the biggest issues is to get all the signatory bodies and the stakeholders involved in HIV to work together.
It's a problem that we can solve together, and we need to work together to make sure that everybody knows which bits of the system they're working on.
One of the biggest challenges in terms of HIV advocacy, prevention and treatment is a lack of targeted approaches for those who are most vulnerable to acquiring HIV. I think one of the ways that we can overcome that is by ensuring that the key populations, the priority groups that we need to reach, are being involved not just in consultation but in the co-design and co-production of the services that are going to be delivered.
We're running the AIDS Histories and Cultures Festival for a whole month with the BFI, the V&A, over 40 partners and a lot of academia, and it's about connecting histories and communities, but we're doing it through the arts so people can have visuals, films, have plays, and can connect to the emotions of HIV/AIDS, and it rehumanises an individual.
For me, the main issue is getting to zero stigma. For people living with HIV, that is the thing that is limiting most of the opportunities in getting to zero in relation to transmissions and deaths.
I think the major challenge is around late diagnosis. So it's about making sure that we can test more people more often, making sure that testing is much more accessible. So online testing, community testing, lots of different opportunities for people.
I'm the director for ShipKick, which is the Sexual Health in Practice community interest company. Basically, we're a social enterprise and we run training for GPs and practice nurses where we talk about rapid risk assessment that's appropriate for the general practice setting. When we've been commissioned in Haringey, the GP testing rates for HIV have gone up 6-fold, so we know the intervention works.
I think if we are to move to a point where we reach the targets that we're looking at, we have to be brave. I mean, really, really, really brave. And innovation is going to be the key.
We need to scale up our efforts and ensure that we're using scarce resources effectively, but partnering with a wider range of colleagues, of communities, to ensure that we're harnessing all of our energies to make ending HIV a reality.
I think that the potential for London as a fast-track city is phenomenal. I think what we've been lacking is a joined-up programme of work and the potential to be able to harness the gains that we've already made and go from 90 and get to zero in 10 years is genuinely achievable with the passion and the will that we've got in this room.